your center. And one of the things you like to think is that you're Tampa's premier center for implant dentistry. So what is the setup you have? Because you say it's very unique. Tell me about that.
It is. So most patients who come to me for the first time come for a consultation. They haven't met us. They don't know what their options are. So they come in and we take a CT scan just to see where they're at. And that's part of their complimentary.
This is complimentary.
Yes,
okay.
it is. Yes, it is. I want people to know what the options are without feeling like they have to commit.
Okay.
Because in the end, what's most important to me is that the patient gets treatment where they feel most comfortable and trust their provider the most. Okay. So we take the scan. I tell them what I see and what I would do in my own mouth if I were in their situation. And then we give them options. They usually go home, think about it, and then come back and get the treatment done. What's nice with our setup and with our what we have going in the office is that we have our on-site lab. So I'm able, for that second visit, when we set up the case for everything to proceed smoothly, first time around, everything done right, is to bring the lab technician in to really design their smile with them. So Hannah comes chairside and decides what the color of the teeth is going to be. This is a really fun visit because we're planning their new smile, right? And then the next time they come in, we're getting it all done. So at that visit, we're switching, whether we extract teeth or we do veneers or whatever it is that we do for this patient, we finish right there in one visit. Sometimes patients get sedated, sometimes not. And then we usually see them shortly thereafter for a post-op check. And that's when all the fun stories come out of how their life has changed, because now they're able to chew again the foods that they haven't been able to eat, or they can smile with confidence, or they can talk and their denture isn't going to pop out, or they have to feel like they have to push their tongue down to keep that denture in place. And then we see them for life, right? There's always maintenance that needs to be done. So
you do everything there.
We have 6 hygienists in the
many
office.
centers,
yes.
they just do the implants and somebody else.
Right. There are some centers that perform great implant dentistry, but that's all they do. So what happens is their one tool in their toolbox is dental implants. Well, maybe the patient would also benefit from something else. Maybe they could save some of the teeth and we could just restore them. So what's nice about coming to a general dentist with additional training that makes them that expert in implant dentistry is to be able to diagnose the case in a way that a general dentist would, trying to save what we can. If it makes sense, we'll have a conversation about it. Obviously, the dentist won't make that decision, the patient makes that decision. But what it enables us to do is treat the patient to the best of their case, their ability.
Okay, you know, people need to know that this interview is a real interview. I'm not trying to side with you, but from our website, people will always say, who should I see for this?
Yes.
Who should I see for that? Whether it's a cardiologist, whatever. And we have to diplomatically always say the same thing. Look for somebody that's a specialist in their field, somebody that has a board certification in their field, because that shows that they went that extra mile.
Yes, and that's what
you have that.
That's what I would recommend.
That's one of the reasons why I liked having you on the show.
Well, thank you, Randy. So there's a board for oral implantology. It's called the American Board of Oral Implantology, and they offer a certification. It's a rather rigorous process. You have to have about 700 hours of continuing education, and then you have to provide cases to them. You actually have to prove that you know what you're talking about.
Okay.
And they quiz you not just on they examine you not just on the surgical aspect of placing the implant, but also of the teeth that you put on top and getting it in the right bite and following up long term. So somebody who's board certified with them has shown that they're capable of treating the treatment range from beginning to end. They're not just going to place the implant.
In the old days, you did it the other way, right?
That's how it was done.
Where you sent it to the oral surgeon or periodontist.
Exactly.
And they come back to you.
And then sometimes they go to the prosthodontist for the restoration and then go to the general dentist who hasn't been involved in the case at all to then maintain it and figure out if the case stays well. So is that general dentist really able to see afterwards, do the implants need more care? Is there starting to be some bone loss? How do we treat it if there's a complication later? What if gum disease develops? You know, you want somebody who's really an expert in that field to follow you through the years.
In both the surgical part and
the restorative part.
So you couldn't go back to doing it the old way, the way you did it
I would
many years
never,
ago.
nor would I let my family member do it that way. Why would I? This is the new way to treat patients, and it only makes sense to me.